Percival is a unique next generation of aortic valves that are being implanted surgically, but in a very elegant and a quick way. The valve is different than usual standard valve that we are implanting surgically by having a cage rather than a traditional stent. And it doesn't require to be put in with multiple stitches. Usually it's 15 to 18 stitches. So therefore it allows the surgeon to move quickly and more efficiently while implanting the valve. So I think the main advantage for the patient remains the size of the valve compared to the size of the patient when we implant the valve. In other words, we can implant larger size valves compared to the sutured valve that are being done surgically in the traditional way. The other advantage that is important, that you can do it much quicker with much less time on the heart-lung machine, and which will translate into probably better outcome and quicker recovery. And thirdly, because of the nature of the valve and the ability to implant it without the need for sutures, it can be done through a very small incision with much less interruption of the chest cavity that will be less painful, and patients can recover and get back to a normal life much quicker. And the second aspect of the patient outcome, very important, is the ability to implant the valve through very small incision that will allow better cosmetic and functional recovery after surgery. It also gives us the ability to perform minimally invasive approaches in patients that maybe in the past we didn't think that they are good candidates for minimally invasive approach due to body size and some other factors, that having a valve that is not requiring multiple sutures simplify the approach, so we can extend the minimally invasive approach to many more patients. So for me, if the patient has the right size and the right indication for this valve, I would probably say that this is my default valve. All in all, if you can perform a safe, quick, minimally invasive approach with excellent clinical outcome when it comes to a valve position in place with low gradient, the length of stay should be short. The vast majority of my Percival patients in the future are going to have a very small scar, either in the front of the sternum or the side of the chest, because of the ability to implant it safely and effectively through a small incision. We were very fortunate to be very active during the study, so we implanted the valve in quite a few patients. The outcome in general was superb, which was kind of reassuring. Even with the new technology, a new valve, we didn't have any major complications, and the learning curve was very easy.